I think it's really important. Today was excellent for me. It's particularly helpful to me be able to network with people living with dementia, their carers, as well as other professionals from both the research and the clinical perspective.
And I think it is being able to network with all sorts of different organisations and individuals who are living with dementia and with their carers, so that we can really engage with them and take their perspectives into consideration in all of the work that we do. That's really important. I think that's critical. I think again the focus of our work is around person-centred care. If we get that right, everything else should fall in place. It's looking at the person as an individual with a history that is really, really critical, and through our films we're trying to convey the importance of that to the staff working in the NHS and beyond, to make sure that they take that really important consideration into account when they are working with people living with dementia and with their carers and their extended family.
I think for me, the person-centred aspect is just not about the person in isolation, it's about the family and their carers. So it's a bigger approach that we take. So it's almost bringing person-centred care to the focus, but then taking it beyond person-centred care, where we start to look at how we live as a whole. And so the living well part is really important, and then the we statements that we heard about people's rights and how we can work together to try and change things is a really good start. And those things are transferable in the clinical world across other domains as well. So that would expand the same to people with frailty and beyond dementia in elderly people. What we need to learn as a whole, that we need to sort of raise and put into practice daily. They're extremely important that these resources are free and available and they're evidence-based, which they are, but there is support behind them. So we wouldn't expect people to just be able to run with them. We would like them to look at them and to be able to work with us to get the support they need to deliver them to the standard that they feel comfortable, or to help them with training. So there is additional support behind. They're not just there as a package. There are the team behind to help share and collaboratives that we work with, and people that we can put people in touch with to, if there are any questions around those resources.
I would echo that, and I think that there is a lot of choice in terms of dementia education and training resources out there, and that will remain, but it's very important that we sort of uphold quality products and that we promote those and give people choice, and so it's that element of choice that I think is important, and that we make best use of those resources, given that in the current financial climate, that we are able to signpost people to good quality products that they can then reflect on and adapt and take forward according to their own local needs, and that's something that's really supported from the research perspective that Leeds Beckett University is working on. So I think that's really important.
And alongside that, because our business is the workforce and about career and personal development, they're also built-in competencies designed to help support people to develop within the pathway to enhance their career. It's very important. Today we launched the e-book, the Dementia Guide for Carers and Care Providers, and for us today it was really important that we have representation from the carers that had inputted into the book, that was over a 2-year period, and have given a lot of information to help us develop both carers and care workers in their roles. And so it's vitally important that it's a voice that's equal and that we work together. So ours is not more important than carers, that we are equal and that we listen to both. And the book is designed that it is of a language that should be able to be available for the public, for anyone, and for professionals. And I think for me that's really important in the work that we do, that whatever we do is supported by those living with dementia or their carers, and that voice is in the work that we have presented today.
And I would echo that. I think in terms of health education in England, it is a principle in whatever we do. The voice of the person living with the condition, in this case dementia, and those who are part of their wider family, that their views are taken into consideration and that they help shape the direction of travel that we take with the work that we do, because it is about then the authenticity of what we're trying to do, rather than us trying to second guess, which is not the way forward.
I think it's been, for me, was sitting in the auditorium with carers and people living with dementia and providing honest and open discussion, and feeling like all sides could share what their thoughts were in order to try and move the agenda forward for dementia. I think that was very inspirational, and it was amazing to hear what people thought. And so if sometimes you're thinking it but other people are saying it, it makes it a real action. So I think some of the calls to action today have been in people's minds, but not in an open forum in such a strong way. And I think that was very inspirational.
And I think I would echo that in terms of there was a real sense of passion in the room, and a real sort of shared agenda that came through in terms of the sessions. So I think that's really positive, and I think we cannot underestimate the role that those who are living with dementia and their carers play in that part.
I think if I'm allowed a second one, it's the networking and the people that we've met. I mean, people that have come up to our stand and looked at the products, and the opportunity to share those, and we'll be in contact with people that have come up to us has just been incredible, much more than we'd anticipated. So the networking has been